Hello, I'm Dr. X, a doctor working here today. May I confirm your name and age, please?
Hello, doctor. My name is Donna Jones, and I am 45 years.
Okay, how may I address you?
You can call me Jones.
Okay, Ms. Jones, today we are going to talk about your health issues. Will that be okay with you?
Okay, doctor.
Okay, and during our conversation, I might take some notes down. It's strictly confidential. Is it all right?
All right, doctor.
Okay, Ms. Jones, can you please tell me in your own words what have brought you here today?
Yes, doctor. For the last 1 year, I am feeling that I am being increasingly more and more tired. And because I was very active person previously, but for the past year, due to my weakness, I couldn't even do my jobs that I could do easily before. I could walk a mile before, but now I cannot walk it walk more because even sometimes I need to go to market by car. I would usually go to market by my foot previously, and that is also bothering me, and that is becoming making me very concerned that why I am having this.
Yes,
And,
yes, I am very particular. Yeah, please continue.
sometimes I feel a little shortness of breath while I do some exertional job, and even walking along some stairs makes me feel shortness of breath.
Yeah. I am very sorry to hear, and we are trying to find out the cause today. And may I know that you told that you started to feel tired about 1 year back? Can you please tell me that did it come along suddenly or gradually?
It came gradually, doctor. Initially, I was somewhat active, and day by day, I am becoming weaker and weaker.
Yeah, I'm very sorry to hear. And can you please tell me that for how long do you think that you feel this tiredness? All the time, or is there any specific time period?
No, doctor. That is, there is no specific time for the last 1 year. I usually feel this when I do any job, any work, and I feel
Yeah,
better at rest.
okay. I get it. Do you think that any time of the day you feel it more bad, like at the end of the day or something like
No,
that?
not time, but it is related to my exercise or any activity.
Okay, I get it. And when it starts, this type of tiredness, how long does it persist? Just for duration for during the exercise, or just does it persist even after that?
No, after taking some rest, I feel better.
Okay, and how frequent is it? Is it more frequent now than before?
It is not about the frequency, but it is about the severity. It is incapacitating me day by day.
Yeah. I'm very sorry to hear that. Have you ever noticed that? Is there anything special, anything that makes it worse apart from your exercise or work?
Then something that I feel when I incline, that makes me feel worse, like along the flight. Yes.
Sorry. Can you repeat?
Just raising or walking up along the flight or any stairs, that makes me somewhat bad.
Okay. Somehow raising from chair. Okay.
Not stair, just inclining or some stairs.
Okay. I get it. I get it. And well, uh, well, and some stairs. Okay. And can you please tell me some more about your shortness of breath? Okay. For how long have you been feeling this shortness?
All this came simultaneously. and it is progressively increasing.
Yeah. So it's progressively increasing. Yes, I get it. I'm sorry to hear. And do you think that uh, it stays for the same period as your tiredness, or is there any difference between these two?
Not a significant difference.
Okay. And have you ever felt that you have to use some extra pillows while sleeping?
No,
Okay. Do you feel any racing and pacing of your heart?
no,
Okay. Do you feel any chest pain?
no,
Okay. Have you ever blacked out?
no.
Okay. And have you? Okay. And well, do you think that there is any difference when you just stand from sitting up, that you feel any dizziness or something like that?
No.
Okay. Okay, that's all right. May I ask you some other questions now? Uh, do you have any headache?
No, not
Okay. Any
something.
range temperature?
No,
Any problem in your vision?
no,
Okay. Can you please tell me that do you have any weather preferences?
no,
Okay. Any changes in your bowel movements?
no,
Okay. There is no change. Okay. And do you think that any? May I ask you that it's a personal question, but do you feel any changes in your menses?
no,
Okay, that's all right. Uh, well, uh, do you think that there is any weakness in any parts of your body?
no parts. It is generally all over the body. Same.
Generally, yeah. Okay, that's all right. Do you have any pain in your joints?
No,
Any rashes?
no, I haven't noticed.
Okay, that's all right. Uh, do you have any chest tightness?
No,
Okay, any noisy chest?
no.
What about your water work? May I know about it?
It's fine, doctor.
It's fine. Okay, that's all right. And that's all right. And may I know some other? Have you been any failure like that before? Have you failed like that?
Yes, doctor. One of my colleagues said that I am becoming more and more failure day by day.
Yeah, for how long have you noticed it? When did you first notice it?
For the last, maybe for the last couple of months.
Okay. I get it. Well, can you please tell me that uh, have you experienced any lumps and bumps anywhere in your body?
No,
Okay. Now I'm going to ask you some personal questions. I'm sorry to ask. Do you have any history of your in your family of any bowel cancer or anything like that?
yes, doctor. My father had bowel cancer.
Your father had bowel cancer. Okay. At what age can you remember?
Maybe he was around 55.
Okay. And any other persons in your family, your uncle or any other persons or your grandfather, do you know of them having any bowel cancer? It's a bit unorthodox to ask you, but I'm sorry. But can you tell me?
No, they no bowel cancer, but my mother and grandmother had some thyroid issue.
Okay. I get it. May I ask you that do you suffer from any diseases?
No, doctor, I don't have any other condition.
Okay. Any long-term condition you know, or no condition at all?
No, I was totally fine before this symptom.
Okay. And may I know that how about your mood? Have you ever been to any doctor for your any mood condition?
No, doctor.
Okay. Have you ever had any fits?
No,
Okay, that's very good. That's another personal question again. May I know about your diet habits? Do you maintain some special dietary habits?
yeah, yes, doctor. I am usually vegetarian and eat a very less amount of meat, and sometimes only on the occasion or on any invitation, I usually take some red meat. Otherwise, I take more
Yeah,
vegetables and
yeah,
fruits.
yeah. I get it. Well, may I know for how long have you been uh, following this type of dietary habits?
Yes, doctor. I am that may be about most of my life.
Most of okay, that's all right. That's all right. I'm just asking you. Well, may I know that have you ever been undergone any surgery of your tummy?
No,
Okay, I'm just going to ask some more personal questions. Do you smoke, Ms.
no.
Jones? Okay, do you drink alcohol?
Yes, doctor. I drink, and that is usually on the weekend, maybe
How
around
many pints?
around 1.5 bottle. That maybe around 15 units per, mostly at the weekend, and a very
Okay,
less
so
amount
I
at
think
the.
it will be tantamount to actually binge drinking. Okay, so many pints. So it will be better if you cut down your alcohol intake. If you want, we can refer you. We can involve counseling for that. Is it all right?
Okay, doctor.
Okay. May I know that have you been any medication?
Yes, doctor. After having cancer, my father, my
Mhm.
one of my friend, she's a nurse. She told me that aspirin help to prevent this condition. So she advised me to take aspirin to prevent bowel cancer, and I am taking that for last 5 years.
Okay, for last years. Okay, I get it. And well, has there been any increase in the dose recently?
No, doctor.
Okay. Well, are you allergic to any medication? Do you know of any?
No,
Okay. And do you ever take any herbal medication?
no,
Okay. I'm sorry to ask, but do you take any recreational medication?
no, never.
Okay. And have you been to travel to any other country recently?
No,
Okay. And I'm sorry to ask, but I have to ask this: Are you sexually active?
doctor,
Sorry, but do you have a partner?
I don't have any partner, or I haven't married, and I usually like myself being single.
I'm very sorry to ask, but I had to ask this. I'm very sorry. And may I know that do you drive?
No, doctor.
Okay. And did you ever have any history of falls?
No.
Okay, that's all right. And you told that may I know what you do for a living?
Currently, I am not doing much thing. And, before that, I worked as a guard at a school.
Guard.
Yes.
Okay, so this is hampering. I think this fatigue you tell,
Yes,
this
but I,
tiredness. I think this is hampering.
I am feeling fatigue mass for the last few months, so I left
Yeah,
the
yeah,
job.
yeah, yeah. Yeah, yeah, I can get it. I can get it. It's I'm very sorry to hear, and I will involve the social services as soon as possible. And may I know that do you have any support at home? Because you told that you want to be single. So isn't it getting difficult for you?
Yes, doctor, somewhat difficult, but I can do my own jobs. I can maintain my
Okay,
personal hygiene, so that is not a big issue.
okay, okay. That's very good. That's very good. Well, may I know what your concern is, Miss Jones?
Oh yes, doctor. Do I have cancer?
Okay, that's very natural for you to ask about. But based uh, on the symptoms that you have told and the history I've taken, it's unlikely that you have cancer. However, I cannot be totally sure about it at this moment, but it's unlikely. But it may be possible that your symptoms that we are getting now is maybe due to your dietary habit. I cannot tell for sure at this moment, but it's highly probable that your diet is causing these symptoms now. And also you take alcohol as some binge drinking, although you take it at weekends, but you actually drink quite a lot of alcohol. So actually, we will have to rule those things out. And for this, we will run some blood tests, and also to rule out whether you have a cancer or not. We will also have to run some camera tests, and also we may do some other scanning tests as well. And we will involve the bowel doctor and others, and other important bowel doctor and our consultant also, and get back to you as soon as possible after getting the results. Will it be all right for you, Ms. Jones?
Okay, doctor.
Do you have any more concerns?
Yes, doctor.
Yeah, please.
Yes, I am taking aspirin. Can it be related to it?
Uh, well, actually, it can be related, I think, but at first we will go through the other issues, and we will also think about it, that whether aspirin is causing this. We will also consult with our consultants and get back to you.
Okay, doctor. Thank you.
Okay. Okay. Any more concerns?
No.
Okay. Okay. Hello.
Yes. So tell your diagnosis.
Well, I think that the person is suffering from megaloblastic anemia due to her dietary habits. The vegetarian, she has been vegetarian for her life, and I think that this is now causing her symptoms. And also, she has been involved with some binge drinking of alcohol, especially in the weekends. So this can also be a cause, I think, for her symptoms. And although she doesn't have the any bowel abnormalities right at this moment, but yet I think that the bowel cancer might be a very distal probability, but it's not actually very much considerable at this moment now.
Okay, for her megaloblastic anemia, do you think any other cause at her age?
Well, actually, I ruled out some important causes. I ruled out thyroid issues. I ruled out alcoholism, and I also ruled out some drug issues like methotrexate, phenytoin. And I think I missed one thing. This is I think myelodysplasia. So I haven't got through this. I think I might have I should have gone through this.
Okay, and any other autoimmune condition do you think?
Well, any other autoimmune condition, this can be pernicious anemia. This can, but actually, pernicious anemia, she didn't give a history. When I took history, she didn't give any history of thyroid condition, and also no condition of Addison's disease, I think. And although her mother and grandmother had some issues with the thyroid, but I just couldn't elicit any history from them, from her. So I haven't brought it here.
Okay, actually, this probable diagnosis was pernicious anemia because it is the one of the most common cause of megaloblastic anemia.
Yeah, I get it, but I'm not sure, but because I just couldn't elicit any other thyroid issues in the lady, so I actually omitted it.
Is thyroid issue necessary to diagnose pernicious anemia?
No, it's not necessary at all.
It's autoimmune condition, and she has history of autoimmune. She has family history of autoimmune condition, and for her, this can be a case of autoimmune presentation. Though your other different
Yeah, that's
fine.
completely okay. Yeah.
Okay, how would you investigate her?
Well, first of all, I will do the blood test, and also then I will go for the autoantibody checking for anti intrinsic factor antibodies, and also some other anti-TPO and other autoantibodies, ANF filing. And then I will also go for some stool routine microscopic examination, and also go for camera test, that is colonoscopy, to find out whether any problems are present or not. And of course, at the beginning, I will have to do some of the routine tests. Okay, some of the routine tests, including semi-UD electrolytes, function test, CBC, PBF, all of this. Okay, and all of this. And
What do you
I think that,
expect in peripheral blood film for this lady?
yeah, I think that I would expect a hypersegmented neutrophil in the peripheral blood film
And
oval macrocytes. Oval macrocytes, peripheral blood film, and also reduced amount of platelets, I think, and increased reticulocyte, and decreased reticulocytes.
okay.
Hello.
Okay.
Yeah.
Why the reticulocyte count will be decreased?
Hello.
Why decreased reticulocyte count?
Why decreased reticulocyte count? This is a problem of maturation, I think. So the maturation is arrested, so it doesn't go to that reticulocyte stage. It remains in that hypersegmented neutrophil stage. It cannot go to the maturation stage. Reticulocyte is just the big stage of final RBC maturation. So I think that's the cause.